Biological hazards. You could be exposed to biological agents at work, sometimes as elements of your work environment, as with a microbiology laboratory, or through inadvertent exposure in the course of your work, as in agricultural, healthcare, or waste disposal. This chapter will review key risk areas. Bears. If you come face to face with a bear, do not run. Bears can run faster than humans, up to 50 kilometers per hour. If you follow your natural instinct to flee, the bear will follow its natural instinct to attack. Back up slowly, speaking aloud to the bear, while deciding what type of bear it is. Grizzly bears have a stout, chunky build, predominant hump, large head, and hair that is usually white-tipped. If a grizzly attack is imminent, curl up in a ball and protect your neck, stomach, and thighs. Black bears have a small shoulder hump, and they are typically black with a brown muzzle, although they can be brown or blonde. Black bears can often be intimidated by a show of force. They are not likely to pursue you as their next meal. Despite their size, they are likely frightened that you will attack their young or their food supply. Deer, moose, and elk, some of which can reach almost 500 kilograms, can be inclined to inflict severe injury on humans if they are in the rutting season or have just calved. These large animals create a driving hazard by being on the road, especially at dusk and dawn, after dark, or when the roads are icy, snowing, drifted, or slippery. In a given year, there are thousands of collisions involving wildlife. These collisions often result in vehicle damage and serious injury or death for drivers, passengers, and the animals. We cannot change animal behavior, so drivers need to take full responsibility for highway safety in animal country. Watch the roadside, especially at dusk and dawn, when low light lessens visibility and when the animals are more likely to be crossing the road. If you do spot an animal, slow down and look for others. They tend to travel in groups or pairs. Animals don't watch out for you. It's your job to look out for them. Ticks. Ticks look like small, flattened spiders. They have 8 legs, 2 body segments, and appear harmless, but can carry and transmit rare diseases, Rocky Mountain spotted fever, and Lyme disease. When you are in the woods in the spring, you should elasticize the wrists of your sleeves and the ankles of your pants to prevent ticks from ascending your body. Mosquito repellent containing DEET also helps repel ticks. It is recommended that during the spring season, at the end of each day, you do a full body search for ticks. The neck, armpits, and groin are common hiding places. If you find a tick embedded in your skin, don't panic. Applying a hot match to a tick or rubbing it with gasoline is not recommended, because either could increase the risk of infection. Gently but firmly, using tweezers or pin, remove all parts of the tick. Use an antiseptic to clean the wound. Seek medical advice at a local clinic or hospital. Mosquitoes. West Nile virus. The West Nile virus is another biological hazard that you may encounter as part of your work-related duties. This mosquito-borne virus can cause swelling and inflammation of the brain and spinal cord in horses, birds, and humans. Symptoms typically include fever, fatigue, headache, and muscle or joint pain. Severe reactions include stiff neck, disorientation, tremors, muscle weakness, paralysis, and death. No cure exists for the West Nile virus, and there is no approved vaccine to prevent infection in humans. Workers who have these symptoms should seek immediate medical attention. Humans can contract West Nile virus from the bite of an infected mosquito. However, the primary source of the virus is birds, especially crows, blue jays, ravens, and magpies. Workers at sites near stagnant pools, ponds, watering troughs, irrigation ditches, rain barrels, lakes, or sloughs are at increased risk of mosquito exposure. Preventing exposure is the best defense against West Nile virus. To reduce your exposure, limit work at dusk or dawn near standing water, or when and where mosquitoes are highly active. If there's a risk of being bitten and it is not possible to limit the exposure, wear light-colored clothing, long-sleeve shirts, long trousers, and socks. Wearing 2 layers of clothing and elasticizing your sleeves and pant legs offers you greater protection. In some situations, it is advisable to wear special bug jackets and bug hats made of netting. Insect repellent containing DEET or an equivalent substance should be applied according to manufacturer's directions to unbroken skin that will be exposed. Wear gloves if you're handling birds or any wildlife that was found dead. This places a protective barrier between you and potentially contaminated animal blood or other body fluids. Hantavirus. Hantavirus pulmonary syndrome is caused by a virus found in some rodents. All rodents should be dealt with as possible carriers. The virus is rarely transmitted to humans, but when it is, it can cause severe illness and death. Early symptoms include fatigue, fever, and muscle aches, primarily in the thighs, hips, and back. A worker with any of these symptoms should immediately tell a physician of their symptoms, work conditions, and possible exposure to the disease. The best ways to deal with this disease are firstly to prevent it, and secondly, to obtain an early diagnosis. The virus is usually spread to humans through inhaled particles, and sometimes through contact with broken skin or the membrane lining of the eyelid or eyeball. If you must clean an area where rodents or their droppings are present, be sure you take appropriate precautions. These should include minimizing your exposure, providing adequate ventilation, using PPE and respiratory protection, and wetting the droppings so they cannot be inhaled with a solution containing a detergent or other cleaning agent that can deactivate the virus. Tetanus. Tetanus is a disease of the nervous system caused by bacteria. Early symptoms are lockjaw, stiffness in the neck or abdomen, and difficulty swallowing. As the disease progresses, it can cause fever, elevated blood pressure, severe muscle spasms, and, in about 11% of cases, death. The bacteria that cause tetanus can enter your body through a break in the skin, even from a simple injury like stepping on a nail or scraping your skin on a railing. Be sure your tetanus vaccinations are up to date and report all workplace injuries.